in our part of the world, prejudice is so strong that stigma is something that is taking a long time to go away. But we know that the statistics say that it's not HIV that really kills so many people. It is malaria.
Stigma remains the single most important barrier to public or societal action. It is known to be fueled by ignorance, fear, myths, social judgment, and lack of interaction with people living with HIV. It is the main reason that impede uptake of HIV testing and adherence to treatment, which impacts negatively on the quality of life of HIV-infected persons. Stigma is a barrier to achieving universal access to HIV prevention, treatment, care and support, and hinder progress towards achieving the health-related Millennium Development Goals. In Ghana and elsewhere on the continent, people fear the social disgrace of being associated with HIV, let alone being diagnosed positive or even perceived as positive. It is against this backdrop that our news team caught up with an HIV patient and ambassador, JOYCE Mensah, who narrates the genesis of her incident.
I'm the last child from my parents. I was born in the Volta region, but I was brought up in Accra here. So I went to the primary school through to JSS in Accra. But financially, there were a lot of challenges. So where I actually wanted to get to in terms of my education, I couldn't get there because my mother didn't have that much. So at a point, I had to sell so many things to support my mother. And it got to a time when my mother had to travel and visit my grandmother, and I was left alone. Even though I had a stepfather, he wasn't capable of providing our things. So I did all I could. I had to sell in the morning before going to school, and it was very, very difficult. It all started when I was looking for a producer when I recorded my album. Because I didn't get a chance to continue with my education, I knew I had a talent. So God being so good, I recorded my gospel album, which I was looking for a producer. I never got. So when I was going to church, I used to fellowship with the Church of Pentecost with my mother, and it got to a time that the one who wanted to support me wasn't in that church, so I had to go to his church, and I wouldn't want to disclose the name of the church because that is where I got infected. And this man was in the church. When he spotted me, he had some interest. He developed an interest in helping me, and I also realized that he fell in love with me. He wanted to marry me. That is what I saw. Because when the first time I went out with him, the first question I asked was about his marital status, which he told me that he's not married. And he said he's waiting for the right person. So I realized that the posters I even did for my album, he could take the posters, put it all around his vehicle, and be moving around with it. So I saw the passion in him for supporting me. Sometimes he gives me money for my classes. I used to do a computer classes without even asking me for sex. So that is how I saw him to be a very good person. So one day he invited me home, and he was insisting we have sex, which initially I didn't want to, because I knew we were in the same church and in the same church choir. As a Christian, when you are fellowshipping, you know that you don't have to have sex with a man who is not married to you. So I was just following that principle. But unfortunately for me, when he insisted for a long time, I gave up, and then I also had sex with him, which was unprotected. Initially, when I insisted, he used a condom. He used it and took it off before he penetrated me, and not knowing he was living with HIV, which I didn't know. But of course, he knew he had HIV. So with the intentions of infecting me, I don't know why he did that. And actually, I was just waiting for a time to get close to him and ask him that, since we met, I've never offended you. There had never been a day where we even had a quarrel. So if you know you have such a thing with you, why do you have to infect me? Because at that time when I met this man, I was just 19 years old.
Did you see any signs on this man when he insisted on having sex with you?
Actually, I saw it. For the first time I met him, that was the first time I saw his body. Because anytime he was in long sleeves and in trousers, So the day he took me home, when he took off his shirt, I saw that his body was full of skin cancer. It was all over his body. In fact, I got scared. So when I saw, it was bigger, like chicken pox, but you've seen chicken pox before. It's big in size, and he kept scratching his body. So when I saw it, the way it was, I've never seen such a thing before. I know I have had HIV education when I was in GSS and all that, but I have never come into contact with somebody who has HIV. And so when I saw it and I asked him that what was that, he said it's chicken pox. Not knowing it was with him for a long time. Even I learned it was with him for about 3 years before I even joined the church. So he actually knew what was wrong with him, but he lied to me that it was chicken pox. I don't know why he lied to me. So that is what I saw. But because I didn't know anything concerning HIV or the latter stages of somebody who has HIV, I just believed him that it was chicken pox, not knowing he was living with HIV.
She recounts instances where she experienced dehumanizing behaviors such as finger-pointing, ostracizing, abandonment and shunning by people close to her.
I have come to realize that when someone is living with HIV and nobody knows about it, that person doesn't have any problem. But the moment people get to know this person has HIV, the person begins to have problems. The person cannot work or even associate with normal people. Talking about stigma, I went through a lot, because people have finally gotten to know I have HIV. But even though I wasn't falling sick, I wasn't an AIDS patient, I received a lot of rejection from people. I couldn't work again, because where I used to work, I went back there and I was told to go back home. I will be called later. In my house, where I used to live with my parents, I was beaten there because I was going to use the bathroom, and I was ejected from the house. They were trying to even eject the whole family. But because I knew it was because of me, I had to take my bag, and then I left the baby with my mother, and I left the house. And that was when life became very difficult, because I had to start roaming from place to place. Wherever I get to, when people get to know I have HIV, then I have to leave the place. And I got a band in the neighborhood where we used to live. They rehearse, they play in places, and then they get paid. So when I realized I didn't have much to do and I knew I have the talent of singing, I joined this band, and eventually people told the band manager that I have HIV. And the manager of that band, I always say that he's a very good man, because even though he has spent a lot on the rehearsals and everything, when he was confronted with this issue, he said, "You are not going anywhere. You are going to be with us, even though you have HIV."
At other times, she noted, she was verbally harassed, faced physical violence, discrediting language, blame, and gossip.
I have lived with people. Somehow, somewhere, I got money. I rented a place on my own. Yes, because I was paying 30 cedis, and I paid for 1 year. Then the following year, the woman said she's taking 100 cedis. For reasons I don't know. How can you just jump from 30 to 100 for a small room I'm occupying? So I had to leave the place to a different place. I have moved from places to places, and they are uncountable. There was one lady I finally got at Akweteman somewhere. I was living with her, and then she just woke up one day and said she had a dream that I have HIV. So as for the stigma and discrimination, it's very, very huge here in Ghana. And we all have to do something about it. Because today I'm infected, tomorrow it can be you. The way you treat me today, we all forget about the law of karma. You are treating somebody badly today, but you don't know what is ahead of you. So I'm always pleading with people that what I have gone through, people day in, day out are experiencing the same thing. So people should be careful the way they treat people when they know they have HIV.
Regardless of this, she vowed not to infect any individual with the deadly disease. How are you coping in terms of finances?
You know, now I'm the HIV ambassador representing PMTCT, Prevention of Mother-to-Child Transmission, the heart-to-heart which is designed by the Ghana AIDS Commission. And I do go to programs, and I'm a musician, so I have printed some of the CDs out, which when I go to programs, I normally sell. The income is not that huge, but I have to try and live with it because I don't have any solid source of income right now. The antiretroviral is not free. We are still hoping that it will even be put on the National Health Insurance. It is 5 cedis a month. When you go, you take it for a whole month and it is 5 cedis. Maybe I can afford it, but there are some who can't afford it at all. But the issue is that the day you go and you don't get money to pay, they can still give it to you.
Are there any side effects should you take the antiretroviral drug?
Sure. Every medicine have got its own side effects, and with the antiretroviral therapy, there are a lot of side effects. What I experience almost all the time is vomiting. I do vomiting almost all the time. I have bitterness in my mouth. I have complained severally, but there seems to be no antidote to that, because that is the side effect of it. And I'm even lucky because some get some skin problems and a whole lot.
The 2008 Demographic and Health Survey shows an encouraging data of about 75% of women and 79% of men aged 15 to 49 who are willing to care for a family member with HIV. Contrary to this, 50% of women and 58% of men do not want to keep the secret that a family member is HIV positive.
When the pandemic started, or we got to begin to hear about it, it was scary because people were dying in so many places on the globe, and we didn't know why. Today we know why. Today we know that it's even possible to live with it. Today we know that it is just one of those scourges that the devil brings into the existence of humanity from time to time.
Statistics also indicate that approximately 2/3 of women and men only also believe that an HIV-positive female teacher be allowed to continue teaching. This clearly shows that a lot more efforts need to be done in educating people on how the disease is transmitted.
Tell us about your musical career. How did it all start?
So, as for the musical career, it started when I realized that I had a talent, and I went to the studio. I started working on the album, and when I finished the recording, there was no support to bring the album out, and getting a producer was another hell. So it took me so long. The music is 7 years now, and I'm now bringing it out. Fortunately, I have been able to launch it. I will have to congratulate GTV for your support. You have really helped me, especially Mr. Mike Amonkwafo. He's just like a father to me, a father I never had. That when I brought the music to him, he just took it up, and GTV is just showing it almost every day, non-stop. God should really bless all the staff of GTV. The title of the song is Bye Bye. The song Bye Bye has a big meaning. The motivation behind the song Bye Bye is saying bye bye to everything that is holding you back in life. You know that you are drinking too much and you are emaciating. You know that it's drawn all over you, but you just can't stop drinking. You have to say bye bye to it. It's a problem. You know that you can't just look at any beautiful girl and pass by. Every girl that is nice to you, you have to go to bed with the person. It's not good. You have to say bye bye to it. You know that you are stealing. You see somebody's property, you know it doesn't belong to you. You go and take it. It's a sin. You have to say bye bye to it so that you can get the blessings from God. You don't have to wait for a pastor to bless you before you receive blessings from God. It has to start with you, your attitude, and everything. That is the motivation behind the song Bye Bye.
The first time I met Joyce was in my office when I had just become the director of television at GBC. She came and said, I have this music that I want to put on TV, and said, can you help me? And I was like, why not? We are supposed to play people's music because that's a people's station. She talked about her HIV status, and I was impressed for one thing, that I realized that there are people who will not bow to the pressure that comes from misplaced prejudices that tend to make us feel bad about things that we don't have any control over. I thought that was wonderful, and that was the more reason why I thought she ought to be supported.
The national estimates of HIV situation in Ghana for 2011 to 2013 indicate a positive pointer in the reduction of HIV/AIDS. In spite of this progress in stabilizing HIV epidemic in the country, a lot more can be done to prevent mother-to-child transmission to avert new HIV infections among the youth and most at-risk population, as well as to reduce AIDS-related deaths.
As health workers, we have a big role to play in the stigmatization of the HIV patient. Certain comments or actions or inactions or behaviors can reflect or can amount to stigmatization of an HIV patient. But I think now that we have understood the disease much, much better, and then as health workers, we are also protected in case you get a needle stick injury. There's prophylaxis you can take. And then applying universal precautions in the care of everybody, not only the HIV patient, has to a very large extent reduced the stigma that the HIV patient may suffer in a health setting. Socially, it is extremely difficult to measure how stigmatization is faring, but I think families in general, once somebody is diagnosed as HIV, put a nail on your coffin, because it is thought that that is the end of the road. But that is not the picture as it is now. Those were in the days of the mid-90s, thereabout. But now treatment is available, and there are people who are HIV positive who are living very normal lives. They are eating regularly, they are taking their medications, and as long as they are on medications and their viral loads are low, CD4 count is high, they are very much like you and I, and you can never tell who is an HIV positive person, as long as they are on treatment. So the society should not continue to see the diagnosis of HIV infection as the end of the road for the person who is infected.
From the records, it is known that 50 to 58% of people cannot keep quiet when their family members are HIV positive. What are the preventive measures that the public, or yes, we as a society or family should take so we do not contract it, even though we know they are living with HIV?
I think it is important for the public to know that HIV is being treated, or there's treatment for HIV. It's only when there is no treatment or you are not following the treatment schedule that it becomes worrying. But I think currently the messages that I hear on radio and see on air seem to portray a very positive outlook of living with HIV.
According to UNAIDS, HIV discrimination can be reduced through the removal of punitive laws, enactment of legislation, and robust enforcement of protective policies and training of service providers. Others include educating people about relevant laws and rights, promoting contact between those discriminated against and those discriminating, as well as providing access to legal services for affected populations.
There is this notion that when HIV patients come to the clinic or to the hospital for treatment, they are separated from, let's say, someone having diabetes, someone having cancer or whatever. They are segregated. What do you have to say about that?
I think that is a thing of the past, and around the country the National AIDS Control Program has done extensively well, establishing laboratories for testing most of these patients and providing medication at great cost to the nation for all of these patients. And health workers have been trained, a series of trainings have been done, and so in the hospitals there's no separation or segregation of an HIV patient. And besides, until you've tested, you wouldn't know. And most of them would have seen the doctor and gone to the lab before the status is known. So it's not true that they are separated from the mainstream patients. Occasionally, yes, you may want to give them additional care, additional support. So you may have units that are specialized in giving that extra support to HIV patients. But I don't think that amounts to a segregation of HIV patients from the mainstream patient. It's rather to improve the care that they will receive.
A stigma-free Ghana will create an enabling environment for many people to overcome their fears and access HIV services by going for testing and counseling. Testing prior or during pregnancy, accepting referrals for a positive HIV test, and being empowered with information can influence behavior change.
The virus that destroys human life is not AIDS or malaria or any of those things. The bigger virus is human beings ourselves. We are the virus that infects our world because of our attitudes, because of our postures, and because of our discrimination, and because of the way we cannot accept one another as being creatures created in the same context, in the same way, by the same God. Any person who becomes distorted in the way they look at other people is a virus.
It is important to know that stigma, if not checked, may lead to discriminatory practices against people living with HIV and other stigmatized groups.
It is my heart desire that even though I'm going through this, nobody go through it. If you are a virgin and you are not married, keep your virginity. If you are not a virgin and you are not married, you have to make sure that you know your HIV status, and whatever it is, know your status even before you get married. It is the right thing to do.
So, you've heard it all from Joyce, who is the HIV ambassador. Remember, HIV is a virus, but stigma is a disease. Currently, stigma is killing people more than the HIV virus. So, remember not to stigmatize. Be compassionate. Provide a human face to the HIV/AIDS disease. Accept HIV-infected persons to enable them, just like Joyce, gather courage to tell the world their sad but touching stories. This can help others in denial get tested or treated for HIV to help eliminate stigma and discrimination.